Good afternoon, everyone. As Chief Scientific Officer at Vitrolife, it is my pleasure to welcome you to our ESHRE 2020 Scientific Symposium on how artificial intelligence will empower your decisions. AI is being employed in numerous areas of our lives, and it is certainly poised to dramatically challenge or change healthcare. Today, we have two fantastic presentations on this topic. Dr. Angus Tran will provide insight into how AI is being brought to the patient's bedside. Angus is an MD and is the CEO and co-founder of Harrison AI, which is an exciting and fast-growing company focusing on healthcare products and services that utilize AI. As many of you know, Angus's first product in the IVF field, called Ivy, used time-lapse videos for automated embryo evaluation and was developed in collaboration with Virtus Health. Vitrolife acquired this technology in April 2019 and has further developed the technology. Jens Reinstad is a member of Vitrolife's deep learning team, and he will talk today on how that technology has been developed and validated to develop an AI-based tool, IDA-Score, which is designed for embryo evaluation. There will not be a Q&A session at the end of this presentation. Instead, we will use the chat function to answer as many questions as possible. But before we start the two presentations, we would like to take this opportunity to remember and celebrate Professor Michelle Lane, who we sadly lost in February of this year. I would therefore like to invite Professor David Gardner to reflect on Michelle's contributions to embryology and the IVF field. Over to you, David.
Thank you, Mark. In my entire career, this is without doubt the saddest thing I've ever been asked to do. On the 4th of February this year, the world of IVF lost a true great scientist and wonderful laboratory director. Michelle Lane lost her long battle with illness and sadly passed at the age of just 49. Although many of you will know her name and know her papers, perhaps you don't know her career. So I'd like to take just a few minutes to talk about Michelle's amazing contributions to science and IVF. Michelle started her journey in embryology at the age of 20. She was an undergraduate student and she came to work in my lab at Monash University. Following on from that, Michelle stayed with me as a research assistant as we started our journey on investigating the role of amino acids in regulating embryo development. And it was during this time that it became evident that Michelle was really a very smart individual and had the capacity to do a lot more with her career. So I encouraged her to undertake a PhD, which she gratefully accepted. And over the ensuing years, Michelle showed herself to be just an incredible student. These were really exceptional times in the laboratory and for embryology, as we saw one by one the blocks to in vitro development move away as we were able to culture mouse embryos, then sheep, goat, cattle, and eventually the human. During this time, Michelle had no problems completing her PhD, and she did so with great aplomb and on time. And as soon as she'd finished, she'd already had a job offer, and she moved to Madison, Wisconsin, to go and work with Professor Barry Bavister. I remember she left Australia on a very hot summer's day. It was 40 degrees Celsius here in Melbourne. And by the time she got to Madison, Wisconsin, it was minus 20 degrees Celsius. I remember she emailed me the next day to let me know that, you know, it's cold when the snuff in your nose freezes, and she didn't say snuff. She had an incredible period with Bavister and published many, many papers. After which I was fortunate enough to work with her again. I moved to Denver in 1997, and in 98 she came to join us, and we embarked upon a series of translational studies which facilitated the way to single blastocyst transfer. And then in 2003, Michelle finally headed home, and she moved to Adelaide, where she rapidly set up her own independent research and soon became the scientific director of Repromed and indeed became a full professor in her own right. This was Mitch's first paper, published in 1992 from that very first project that she undertook. And this was the first in a large number of papers, 79 papers we published in the following 3 decades. Her research interests were many. During her PhD, she looked at ammonium and birth defects, how amino acids regulated embryo development, and metabolism as a marker of viability. In Wisconsin, she pioneered containerless vitrification, developing the cryoloop, and she also worked extensively on pH regulation in embryos. When she moved back to Australia, into Adelaide, she worked on how stress compromises embryo development, and her latter studies really focused on paternal diet on embryo development and offspring health. And this culminated in this really exceptional review that she wrote in the journal Science, Parenting Before Conception. When trying to assess somebody's career, you can turn to the metrics, and here you can see her citations. She had 20,000 citations and an H factor of 75. Now that's outstanding for someone who's had a full career and retired. For someone at the age of 49, it's somewhat miraculous and just reflects her incredible work ethic. But more than that, metrics don't really reflect the translation of her work. And there's literally hundreds of thousands of couples out there who have got a family now, thanks to her basic research and translational research. You can judge a career also by the legacy of those you've trained. I was very fortunate to be trained by the great and brilliant Henry Lees, and it was my fortune to train the great and brilliant Michelle Lane, who went on to train Deirdre Zander Fox, who trained Nicole McPherson. There was a whole group, many students that Michelle went on to train. And I think it's through them that her legacy, her life's work will live on. We will all have our own ways of remembering Michelle. For me, it will always be as that graduate student. Michelle wanted nothing more than to set out and then help people and to improve the success rates of human IVF, which she did. So now, what can I say? With regards to IVF, one of the only constants is change. And one of the changes we've experienced in the last 3 years is the rise of artificial intelligence and its use. So I'd like to introduce now Angus Tran, who will talk about artificial intelligence from bench to bedside.